paper discusses the development, validation, and comparison of machine learning models for predicting pediatric surgical site infections using the National Surgical Quality Improvement Program Pediatric database. So for a little bit of background, surgical site infections are a leading cause of postoperative morbidity in children, and despite evidence that they are largely preventable, SSI rates continue to rise. There are existing predictive models that are largely adult-focused for SSIs, and pediatric tools that are in existence oftentimes lack generalizability and clinical integration. And these studies tend to be limited by things like small sample sizes, data availability. They tend to include fewer predictors or focus on very specific surgical procedures. And they also tend to have variable performance and limited generalizability. So the objectives of our study was to develop, validate, and compare machine learning models for predicting surgical site infection risk in children, and then recommend a final model for potential clinical workflow integration. This was a retrospective cohort study with over 1.1 million surgical cases from the NSQIP database from 2012 to 2022. We trained our models on most of the cases, over 1.1 million cases, but did have about 50,000 cases as a holdout test set. And the models included predictors like demographic variables, medical history, procedural, and perioperative factors. We tested 5 different machine learning models, and then we evaluated the performance using overall fit, discrimination, and calibration metrics. Overall, actually, all the models showed pretty similar performance, and ultimately we recommended a regularized logistic regression model because of its strong performance, feature selection, its computational efficiency, and then the potential feasibility for clinical implementation. The most influential predictors were things like procedural codes, perioperative diagnoses and comorbidities, patient acuity markers, labs, and patient demographics. And the mean predicted surgical site infection risk in our population was about 2.5%, with a large majority of those with a risk less than 2%, and about 3% of those identified as really high risk of over 10%. So overall, machine learning models can predict pediatric SSI risk using preoperative data. And the hope is that by moving beyond generic risk profiles to generate patient-specific risk, can lay the groundwork for integrating these predictive models into electronic health record clinical decision support tools. And the ability to identify these higher risk patients before surgery can open up opportunities for things like earlier intervention, better patient and family education and informed consent, and improved resource targeting and greater consistency in infection prevention practices. So this is not the end. The next steps for us are to do an external validation using raw real-world institutional EHR data, and then exploring practical implementation into our clinical workflows. Thank you so much.